Raul Mendoza ng Parañaque. What can you say, Doktora, about robotic hair transplant?
Okay.
Robotic hair transplant. Meron ba tayo niya?
Okay. There are two ways to do hair transplantation. I do both strip and follicular unit extraction. In follicular unit extraction, the hair, I use machine to extract the hair individually. And that's one part of the whole procedure. Kasi maraming steps on procedure. And one step is to extract the hair. That is where you use the robotic. Okay, the artist. It just fulfill one part, no? And then there's a pros and cons. On my part, I use a special instrument also to do the same extraction as the robot can do. So it's actually no difference except that you have this big machine na instead of the physician doing the extraction, which is so difficult, because a physician, to be able to perform the extraction of the follicles, you have to really have the experience and the skills and the knowledge. So it parang yung robotic eliminates one of the difficult part of the procedure, but yung result ng procedure does not depend on the robot. It's the whole procedure which is dependent on the knowledge of the physician and the skills of the physician, and how well you do it together with your well-trained surgical team, because it's a procedure that cannot be done alone by physician. Kailangan meron kang group. We call that surgical team, which the physician will train so that they take care of the follicles, yung grafts. Yung grafts na yon na hindi na it will they'll care of it na hindi matutuyo, no, na it will remain viable, fresh, so that when transplanted, it's very healthy, and when it's transplanted very healthy, the hair will grow. Mahirap yung hair transplantation, and the robot cannot do everything. It's just a one portion. And then of course, in my experience kasi, it's just one instrument to do that procedure. In my experience kasi, I have 3 ways to do the extraction of the follicles. Kasi sometimes the machine is not working, and then nakahiga na yung pasyente. We have to do it the other ways. No, I use different kinds of instruments, from the simple disposable needle to a much small machine with a handpiece and a punch, and another machine which is disposable. So you just have to be ready pag nag-malfunction yung isang instrument. And robot is just one machine.
I see.
Okay, tanong naman ni Jen D. Simula nang umakyat ang asawa ko sa barko,